While we celebrate 1 million COVID vaccinations in South Africa, over in the UK, 3/4 of the population has received at least one COVID jab. No COVID deaths were reported in that country in the past 24 hours. Life is cautiously opening up again. I'm joined now by our correspondent in London, Ollie Barrett. So, Ollie, good evening. Life seems to be opening up again in the UK, but still there's a lot of debate about this 21st of June deadline, where things are meant to sort of get back to normal. What are people saying about that?
There's a very strange atmosphere in the UK at the moment, Sally, because, as you say, in many ways the data looks very good indeed. That first 24-hour period with no deaths reported really since the pandemic began here in the UK. Daily fatalities and hospitalisations have been at very low levels, particularly compared to some other European countries. But at the same time, we are seeing cases tick up, particularly cases of the India-discovered variant, which has been concerning various countries around the world. The government is saying at this point that it's too early, really, to say exactly what that means for the future. And as you say, that 21st of June key date when England really is expected to and due to throw off all remaining COVID-19 restrictions. The government is saying it's too early to say at this point whether that can go ahead as planned. They will tell us on June the 14th, and one of the reasons that there is a little bit of doubt is that the government scientists and large sections of the scientific community are saying it's not quite clear yet just how acutely the vaccination programme has broken the link between cases and hospitalisations and fatalities. So they need to leave it a little bit longer, they say, to work out whether this uptick in cases that we're seeing at the moment, as large parts of the UK unlock when it comes to COVID-19, does indeed mean that hospitalisations and fatalities will stay at those very low levels.
Interesting you talk about the variants. We know that the WHO has finally given them proper names to avoid that sort of telephone book of numbers and letters. So the variant first discovered in Kent, I think, is the Alpha variant. The one first discovered here is the Beta variant, and the one first discovered in India, I think, is the Delta. But speaking of variants, there's ongoing research with AstraZeneca, I think, to update their vaccines to deal with these variants. How is that going?
That's right. We heard a little bit of detail today from Matt Hancock, the UK Health Secretary. He says that Britain is now actively in commercial discussions with AstraZeneca and with Oxford University, that partnership, to try and get its hands on doses of vaccines that would be specifically altered to deal with specific variants, including, particularly mentioned today here in the UK, as you say, the South Africa discovered variant, because of some of the concerns that there have been about lower efficacy from vaccines for that particular variant and others. Now, not much detail given to us by Matt Hancock today, but what we understand is that the UK is going to continue contributing funding towards things like clinical trials of these vaccines on behalf of Oxford AstraZeneca, but also clearly there are going to be discussions about securing doses when and if those vaccines actually become available and are able to be administered to patients. So that is very much underway here. It forms part of what is sometimes called the booster campaign here in Britain. We know that the Johnson & Johnson dose is coming online soon after being approved here, and that, for example, is going to be rolled out, we expect, to the older population and to care homes for people to have, many of them will be having actually their third dose of a vaccine at that point. As you were saying earlier, a milestone reached today with 75% of the adult population here in Britain now having received at least one dose of a vaccine.
Makes us absolutely jealous. Thank you so much. Ollie Barrett coming to us live from London. Still